step up their efforts to prepare for a possible H1N1 outbreak. And their efforts are spotlighted now after a report released this week said up to 90,000 people in this country could die from the H1N1 flu strain. CBS Atlanta's Renee Starzyk is asking the tough questions for us about just how ready everybody is.
Stephanie, we pressed for information on training for the staff here, the supply of gloves and masks, a game plan if thousands actually do show up here at the emergency room. Is any hospital ready for H1N1? Those we talked to today admit that is a tough question. Don't come to the emergency room. Not the message you might expect from a hospital, but when it comes to H1N1 flu, experts here at DeKalb Medical Center fear people will flood the place even if they're not severely ill.
I don't know that it would have to turn into chaos. Although it certainly would stretch resources immensely.
And Dr. Adam Bressler says don't show up to the ER just to find out if you have H1N1 flu. Tests will only be done on those admitted to the hospital. State labs simply wouldn't be able to keep up. So we may never know how many cases of H1N1 are out there.
We will absolutely never know. The only numbers that we're going to have based on confirmed are going to be tip of the iceberg numbers.
A sign in the hospital urges you not to visit patients here if you have flu-like symptoms. Should cases of H1N1 ramp up, the hospital will immediately isolate patients who might have the flu. They must wear gloves and masks. So will staff members.
Pretty much from the get-go, when you are hired at DeKalb Medical, part of the orientation process is to talk about not passing on infection, whether you have hands-on contact with a patient or whether you're behind the scenes like I happen to be.
How well trained is the staff right now?
Again, I think it's hard to know until we see.
And what if supplies of gloves and masks run out? The hospital says there are still a lot of unanswered questions.
I think what's going to be the question is if and when it actually happens, how does it play out?
So it's hard to say with certainty at any hospital whether or not you're prepared. Dr. Bressler says if you have only minor or moderate flu symptoms, it's best to stay at home and treat them with medicine. A very severe case, well then by all means, come here to the hospital. We are live in Decatur. Renee Starzyk, CBS Atlanta News.
Do you have concerns about H1N1?